Hello, my name is Mustafa, and today I will be presenting on sickle cell disease. So this presentation will explore the role of family nurse practitioners in the management of sickle cell disease crisis and preventing rehospitalization in the African American population. Sickle cell disease is an autosomal recessive disorder that affects 100,000 people in the United States, 90% of whom are African Americans. 2,000 babies are born with sickle cell disease in the US each year. This disease is inherited, which means that if a person carries the sickle cell trait and produces offspring with another person who also carries the trait, the child will have a 25% chance of being born with sickle cell disease. Life expectancy for those with sickle cell is approximately 20 years shorter than average lifespan. It's a genetic mutation affecting the blood leading to red blood cells. They become sticky, rigid, deformed, clumped together, and then ultimately they get stuck throughout the vessels in the body. When this happens, it can lead to a severe pain, chronic anemia, organ damage, organ failure, stroke, pneumonia, vision loss, and even severe infection. The patient will present with complaints of constant fatigue, dizziness, pain in the bones, chest, abdomen. Collectively, this is all called a vaso-occlusive crisis. There are several reasons for why a vaso-occlusive crisis can occur, including dehydration, medication noncompliance, cold and hot temperature extremes, stress, fatigue, lack of sleep, folic acid vitamin deficiency, alcohol consumption, even smoking. Vaso-occlusive crises are responsible for sickle cell disease patients visiting the ER an average of 3 times per year that almost always result in hospital admissions. So now the question is, how can family nurse practitioners best manage a sickle cell crisis to prevent rehospitalization in the African American population that deal with sickle cell anemia? So the clinical problem is that inadequate outpatient education, limited access to comprehensive care, and poor adherence to treatment result in increased ED visits and contribute to preventable rehospitalizations. To intervene, the key is to keeping sickle cell disease patients out of the hospital. The key to this is preventing a vaso-occlusive crisis from ever occurring in the first place. Nurse practitioners can focus primarily on patient teaching, along with pharmacological interventions. These interventions are guided by Dr. Dorothy Orum's self-care deficit theory, which focuses on the patient's ability to perform self-care and identifies when the provider must intervene and what level of support the patient needs to prevent complications. It's important to assess patient knowledge and provide teaching on maintaining sufficient hydration status. Dehydration is one of the main causes of a VOC, or vaso-occlusive crisis, which causes blood to become more viscous and lead to clumping of red blood cells and ultimately leads to occlusion. It's important to avoid triggers like stress, fatigue, alcohol, lack of sleep, smoking. These are all important lifestyle modifications that will help VOCs from triggering. Recognizing symptoms early is also crucial for initiating prompt management, which can significantly reduce the risk of severe complications and likely will prevent rehospitalization. Medication adherence is the most effective way to prevent a VOC from occurring. However, some medications cause side effects. For example, hydroxyurea can cause severe nausea, vomiting, diarrhea, constipation. This may cause the patient to skip doses and become non-compliant. So managing side effects can be done with antiemetics. It's important to instruct patient to take with food, take with water, avoid spicy, greasy food, and eat smaller, frequent meals. Teaching the patient to perform a low-intensity exercise like Pilates, walking, swimming, yoga has all been shown to effectively prevent a VOC. By doing this, the patient will help promote blood flow, enhance oxygen delivery, and help improve cardiovascular health. Another important intervention is infusion centers. These specialized infusion centers help manage many different types of blood disorders and may be implemented by patients who can recognize the early symptoms of a VOC. And they can present to these centers for pain management and transfusion therapy, which, if caught early, can prevent ER visits and rehospitalization. The provider should assess symptoms of depression as well. In patients with sickle cell disease, depression can be prevalent and has been linked to increased noncompliance with medications and lifestyle modifications. Patients should be scored using a PHQ-9 scale and treated for depression, which can help increase compliance. Other modalities of prevention or intervention could be like massage therapy, which has been shown to reduce pain, alleviate anxiety and stress, and overall improve circulation. Warm compresses are also effective in vasodilating the blood vessels, which helps improve circulation and increase blood flow to the oxygen-starved tissue. Pharmacological interventions include medications like hydroxyurea, which is the gold standard drug of choice for treating sickle cell anemia. This medication works by increasing fetal hemoglobin production and reduces the red blood cell sickling that leads to a VOC. Providers must confirm that females with sickle cell disease are not pregnant prior to being prescribed hydroxyurea, because this is a teratogenic drug. L-glutamine medication is another great choice, which works by preventing the destruction of red blood cells, which helps lessen anemia. Both medications can be prescribed together. Crizanlizumab is another medication that helps to reduce VOC and can be used as an add-on therapy for patients who still experience a vaso-occlusive crisis while on hydroxyurea, or it could be used as a standalone medication for those that can't tolerate hydroxyurea side effects. It's important to keep up on vaccination status. Vaccinations will help prevent infections that can lead to a VOC. This includes like a pneumonia vaccine, meningococcal, HIV, annual flu, Hep A, Hep B. Folic acid supplementation can also be used to help reduce or help support red blood cell production caused by the chronic red blood cell breakdown to help prevent a folate deficiency. NSAIDs and opioids like oxycodone may be prescribed to manage acute pain experienced in the outpatient setting. Implications for practice: providers must assess how a patient copes with sickle cell and provide a structured education program that's tailored to each individual regarding the pathophysiology of sickle cell disease, why the triggers occur, and how they impact the body. Because everyone copes with disease differently, it's important to explore any negative coping mechanisms and provide feedback. Early recognition and preventative care is of utmost importance, as VOCs can result in prolonged hospitalizations requiring resuscitation of fluids, pain management, and blood transfusions. Routine assessment of pain patterns, hydration status, oxygenation, and infection risk should be incorporated into clinical visits. Providers must use a comprehensive multimodal approach to prevent a VOC reoccurrence. Combining pharmacological, non-pharmacological, patient education, all of these will help reach optimal disease control, reduce hospitalization rates, and improve overall quality of life. Recommendations for change: at each visit, providers must include strategies that focus on crisis prevention while including family members in the teaching plan. This has been shown to improve adherence, provide crucial emotional support, and result in reduced hospital admissions. Medication compliance must be assessed routinely, focusing on teaching strategies to improve compliance, and incorporating digital reminders for medication adherence, establishing routine-based habits like drinking water before and after activities, and creating a personalized action plan by developing a written care plan that lists personal triggers, medication schedule, steps for managing pain at home. All of these will increase self-efficacy and ownership of care. A multidisciplinary approach should be used to help improve outcomes. For example, home health provides in-home support that offers tailored care, will help reduce hospital visits and enhance quality of life. Medical social worker is an excellent resource that can help implement community resources and address issues with transportation, facilitate transition planning, and can help address social determinants of health. Coordination with specialized specialists like pain clinics, psychosocial counseling, and hematologists must all be considered for ongoing specialized care. Telehealth is very important and has been shown to improve access to care for patients who face barriers. Telehealth will enable for the ongoing patient teaching and increase compliance with providers' scheduled visits. So what was learned? Patient education significantly improves patient outcome, but prevention is key, which helps to avoid hospitalization, and therefore sufficient patient education must be implemented at each visit. Depression can significantly impact patient compliance with managing sickle cell disease. Exploring and treating depression symptoms will positively impact patient outcome. Early recognition of a VOC, or vaso-occlusive crisis, can reduce hospital admission rates by allowing timely interventions like pain management, hydration, and monitoring, which all help prevent crisis from escalating. Nurse practitioner-led coordinated care improves patient outcomes by ensuring timely interventions, comprehensive management, and continuity of care, which reduce complications and will help enhance quality of life. The key takeaway here is that from the literature is that preventing a VOC and rehospitalization rates require proactive, patient-centered management led by FNPs through education, early intervention, and coordinated multidisciplinary care. I hope this helps shed some light on this debilitating disorder, and that is all for my presentation. Thank you.